Oh, cool. Thank you all for being here to see this. This is going to be, hopefully this will be interesting to everybody. I'm going to talk to you guys a bunch about our work at the Center for Global eHealth Innovation and our work building integrated medical apps. This is obviously a much more specific topic and a much more domain-specific topic than most of what we've seen today. In all honesty, I've had a bit of trouble figuring out what's the right content here. I present this all the time to healthcare developers and people working in the health system. So figuring out how to present this to a group who are developers in general, who are not necessarily working in the health system, has been an interesting challenge. I'm hoping I will nail that. We will see. I will also throw out there that I typically do this with Apple Keynote. I've decided I'm going to try out Google presentations just because, this seemed like an appropriate venue for that. So let's see how that goes. Hi, I'm James. I have the complicated title of Lead Architect and Developer Wrangler at the Center for Global eHealth Innovation. For anyone who hasn't heard of us before, we're actually located in the same facility here, just over on the other side of the building at Toronto General Hospital. We are a research outfit that's a part of UHN, the hospital, whose research is focused on the development of apps for managing chronic conditions. So all of our work is around we have this sense that we can use apps to help our patients live better lives, stay healthier, and ultimately stay out of the hospital and save us some money. So that's been our work. I wear a second hat, which is I've been the project lead for an open source project now for 15 years. This thing called HAPPY stands for HL7 API. We'll talk a little bit more later about what HAPPY is, but I've got all of the joys of trying to wrangle open source contributors for years and years and years. Always a fun thing. I'll throw up the legal stuff. This entire presentation is CC0 licensed, actually Creative Commons Attribution licensed. I would be delighted if any of you want to take this content and represent it to anybody else. There will be links throughout the presentation to where you can get the content. I believe very strongly in Creative Commons and their vision, so take this stuff and do whatever you want with it. I would be delighted to hear that you're doing that. Let's dive in. So I am not a doctor. I'm not a medically trained person. I'm a software developer, like I'm sure most of you guys are. But I mean, for years now, I've had this fascination with my own medical records. Part of that is I work in a hospital, of course. But part of that, of course, is it's just neat to look at the numbers that have been measured about you. So for years, I've been doing this. I'll get a lab test done. I will get my hands on a copy of it. And I mean, fortunately, I work in a hospital, so it's relatively easy for me to do that. And I will spend a bunch of time trying to dissect the data that sits in there. And this is a real example of that. This is something I pulled out of my chart back in 2006. It's a perfect example. So all these numbers are how, they were measured on me a good while ago. Looking at them, being a non-medical person, I got lots of questions. There's a bunch of codes. I see some HBs and some LKCs and some PLTs. If we have any medical people I'm sure you know what those things stand for. I've spent lots of time playing around with Google trying to figure out what does it mean for my HB to be 136 and trying to, should I be worried if it's low? Should I be worried if it's high? Trying to sort of decipher that stuff. I've got some values. There are a bunch of meaningless numbers. There's some reference ranges in there, so it sort of tells me that 140 to 180 is the right HB value. HB is hemoglobin, if anyone is curious about that. But really not much context into, how do I interpret any of these numbers? It makes sense to my doctor? It sure as heck never makes sense to me. Turns out I'm not the only one that sort of thinks about this type of thing. So I love this story. Wired Magazine, 2010, runs this article where they get a bunch of graphic designers, a bunch of creative types to look at medical records and sort of figure out how could we do this stuff better for patients so that they can make sense of it. I know this is very blurry and you can't really see it. And it's not the point what the actual test says, of course. This is a C-reactive protein test, though. C-reactive protein is basically a measure of inflammation in your blood. What they're what the test is getting at is if your CRP test is high, effectively what it's telling you is you are at an increased risk of cardiovascular disease. There are steps you could be taking to sort of live a healthier life and cut that risk down. Bottom line, your doctor will look at that and probably have a good conversation with you about lifestyle changes you should probably be making if that test is high. But of course, none of that is on the page. It's tailored for the doctor who has spent the last 20 years, reading CRP tests. There's no explanation of what a CRP is. There's no explanation of how we might, how I should be interpreting that. There's no explanation of what happens now. If it's high, what should I be doing? None of that is there. It's just a block of impenetrable text for a doctor to look at. So Wired got these creative types to look at that, and they said, how could we reimagine the way that looks for a patient to consume it? And this is the result. This is what they came up with. This should be obvious to everyone how this is better. I mean, this is, again, it's hard to read. I mean, ultimately, take the slides and go and have a closer look at their work, because it's really neat stuff. But I'll try and point to the highlights on it. We've got some great big graphs that sort of contextualize. I can see instantly that my value of 3.3 is in the upper quadrant. We're getting higher. I can see that my risk factors are 15%. That's that 15 towards the bottom. And that tells me that, you know, I've got something of a risk of cardiovascular disease, but I'm obviously not in the sort of quadrant where it's a giant concern to me. There's also a section at the bottom that tells me what next. You know, it's sort of pointing out that if I worry about my diet and exercise a bit more, I avoid drinking, you know, have a few less drinks, gives me something to talk to my doctor about, and basically sort of arms me with the information to, you know, to take better care of myself and actually take the data that was generated around me and do something good for my own health with it. So that was 2010. Wired magazine sort of did this. Of course, you know, Wired magazine is not a hospital. They wrote an article about it, and it sort of sat there on their pages beyond that. Up until a few years later, a group at Boston Children's Hospital, down in Boston, took that same article and said, I mean, great, they came up with a mock-up PDF. Why don't we try and create an electronic version of that? We could actually show our patients. So this is the result. What we're looking at here is, I mean, certainly not an Android app. This is a phone app that this is a web page they created that's presenting that exact bit of data. But they sort of came up with this, you know, this proper interactive view that they could use to show their patients, you know, what the numbers look like. And I mean, ultimately, it's kind of a neat thing because it's interactive as well. I can actually try clicking on it and say, if I cut smoking, you'll see sort of the numbers slide to the side. If I check off that I've got a family history of this or that, you can sort of play with the numbers and see what changes to your lifestyle would do to you. Really neat stuff, actually. So, I mean, my takeaway from all of this is that the presentation of data for a doctor is good for a doctor, fair enough. I'm sure they're very efficient with that. But you can do really amazing things if you accept that coming up with customized views for different people allows amazing things to happen, shall we say. And I mean, really, is that not a perfect metaphor for what we're doing with apps? I mean, this is the entire sort of app economy these days, is that if I want an email client that follows this one very tailored view of how I see the world, I mean, I can definitely find an email client that does that. Why do we not have health apps that sort of follow that same trend? This is part of the focus of our work at the Center for Global eHealth Innovation. Apps have the power to change healthcare. That's what we believe. So I will say one thing. Everybody is trying to create this sort of the Uber for healthcare. I keep hearing that mantra constantly, and I mean, it's a neat idea. There are a bunch of people working on this problem of connecting doctors and patients to be the next Uber for healthcare. My point today is let's move beyond that thought. Uber is awesome as a ride-sharing app. The whole notion of connecting doctors and patients, while cool, and there are some really neat apps doing that, we could do so much more with this amazing computer that sits in our hand with all its sensors and all its internet connectivity and all of that. So what's out there? What are people doing today? I spent some time digging through the Play Store to see what apps I could find in the medical category specifically. Of course, Google doesn't tell you anymore how many apps there are in the category. I scrolled through millions of pages and never got to the end of it. So I'm sure there are thousands and thousands, tens of thousands, something like that. There's lots of apps in the store today. They all follow they all really follow a couple of patterns. The first pattern they tend to follow, I mean, there's lots and lots of guides. People have taken things that are books and transferred them into an app so you can read the book on your phone. They've taken little sort of pamphlets on how to do one specific thing. They've taken, you know, books of recommendations of how to take care of your kids, that type of thing. There's lots and lots of medical apps that are basically sort of literature that existed in paper form that's been transcribed to an app. And I mean, there's nothing wrong with that. It's cool, but it certainly doesn't take advantage of the power we have. There's a whole bunch of sort of single device, single company apps where a company have sort of exposed their platform. I mean, that's a little bit neater. You can definitely do some neat stuff there. There's a lot of that. Weirdly, there are tons and tons of pregnancy and baby apps. I don't totally understand that, but man, are there a lot of pregnancy and baby apps in the Play Store under the medical category. I'm sure there's a reason for that. I don't know what it is. If you scroll way down the page, you really start to get to the ones that I think are interesting. So I mean, this is it. I scrolled down as far as 435, and I started to see some really cool stuff. The apps that are sort of really tailored to helping people manage conditions. You've got things like apps to help people manage PTSD if they're suffering from that, apps to help people manage their blood pressure, to do cancer screenings. This is the really cool stuff. These apps, however, almost universally suffer from one problem that you constantly see in the descriptions. Print the logbook and send it to your doctor. Export the data to CSV files. Show screenshots to your doctor. Create PDFs. I don't know. Throwing my hands up at any of that stuff. All of this would be so much better if these apps were not islands. So, this is the thing I'm here to talk to you about today, is how do we create these medical apps that are not islands, that actually sort of integrate with the entire rest of the health system and exchange data in a seamless way and solve the problems we're trying to solve in a way where we're not just creating these one-off islands exporting PDFs. So how do we do that? I'm going to use basically a little use case. I'm going to talk about one of our apps at the center. And nothing I'm going to describe here is unique to our work at the center, nor are we the only ones trying to solve this problem, but it certainly is the work I know best. So it's an easy sort of reference point to how do you build these medical apps. Meet Medley. If anyone would like to actually play with Medley, the app, we have a demo of it sitting outside and a bunch of wonderful people who would be happy to actually let you play with the app. Medley is a neat little app. The way it works is UHN patients who have just had heart surgery will get sent home with this app, paired in a little kit that comes in a nice little bag that comes with a blood pressure cuff and a weight scale that's been Bluetooth paired with the phone, and it's all sort of hooked up and ready to go, and hopefully reasonably accessible even to someone who has not worked with a smartphone before. The idea with this is not even one of these things where you're installing the app yourself on your own phone. UHN, the hospital, is paying for the phones and paying for the scales and paying for all of the devices for all of this. Because in the end, if we can sort of keep people healthy in their homes, we actually save the hospital money, sort of keeping them from coming back the next time they get out of control and end up having to go back to our emerge. So our view is that these apps sort of help people stay out of the hospital and save us a bit of money. How do we do that? A couple of ways. First off, if you've had heart surgery, it's really important you follow a care plan. You need to be, seriously, every day taking your weight, every day taking your blood pressure, sometimes multiple times a day taking your blood pressure and your weight, and sometimes your blood glucose. There's a bunch of measurements it's really important that we keep track of. So, the phone is kind of a perfect platform for that. The phone is able to sort of help you take the measurements, but it's also able to sort of remind you of what you need to do. So ultimately, it's quite a nice tool for helping people just follow a simple care plan. Not rocket science, of course, but it works really well for that. It's also actually really amazing for sort of getting data, beaming data remotely into the clinicians that are sort of tracking these patients. So one of our most common workflows with this type of app is that we will have the patient, do their weight every day, do their blood pressure every day, answer some symptoms. Am I feeling better? Am I feeling worse? There's a bunch of sort of detailed medical questions we get into. Ultimately, what we're doing is beaming that back into the health record at UHN and alerting doctors if someone is trending badly. And the idea there, of course, is that the doctor has naturally a big roster of patients they're following. If one of their patients, has had weight gain the last 3 days, and for a heart failure patient, it's ultra important that we catch that when it happens, the second it happens. The doctor will follow up. Like the doctor knows now, okay, one of my patients has trended badly 3 days. Let's phone them. Let's discuss medication changes they might make. Let's discuss any lifestyle issues they might be having, and let's get them back on course so that they will stay away from the hospital. Next thing we do, quite commonly, is help people interpret lab tests. So we spend a lot of time working at bringing in lab tests from the outside world, getting those into our apps, beaming them in, basically showing them to the patients and helping patients make sense of all of the data that we're gathering from the hospital with them. And finally, research. So now that we've got this amazing platform, that we're capturing all of this data from all of these patients, we have this incredible vehicle to sort of be able to look across great big populations of patients and say, okay, I can see that these 20 patients, when it rains, they start to do badly, and we can start investigating. Somebody probably has a hunch that when it rains, it gets bad for heart failure patients. Is that causing lifestyle changes? Is there something about the weather pressure? There's all kinds of areas to explore there. And naturally, now that we're gathering constant data and centralizing it in our databases, that empowers researchers to use that stuff to actually make lives better for people with these conditions. So how do we do all of this? I mean, this is kind of the trick to all of this is getting data in and out of the phone, both connecting it with the hospital and connecting it with the devices that we deal with. So the next few slides, the next bunch of slides, are kind of going to go over all of our struggles and all of the things we've done to get data in and off, basically into the phone and off of the phone. The key message to all of this is standards has been the thing that has made the world better for us. And I'm a giant standards nerd, so it's always delightful to see this stuff actually work for us. Bluetooth. I'm going to talk about two things, and the first is Bluetooth. So I don't know how many of you guys have dealt with Bluetooth and Android programming. It's one of those things before I got into this world of trying to deal with medical devices and phones, my exposure to Bluetooth was pairing my phone with my car and pairing headsets with my phone and stuff like that. And I mean, that is a pretty decent technology. I mean, it doesn't generally fail. Every time I get in my car, it's paired the second I get in there, and it doesn't tend to unpair or have problems. The world of medical devices is not nearly as nice. These things fail constantly, and it's awful. We've never really figured out exactly what the reason is, but I mean, the bottom line with this is we hook up to one device. Chances are that we've hooked up to that one device. There's not, it doesn't mean that we've hooked up to 100 devices. We've got one thing working, and we have to control very closely what devices we work with. Standards on that front are starting to make things better. The way that Bluetooth works, of course, is by these things called profiles. So my car, when I pair my phone with my car, the reason that works is that both the car and the phone have implemented the Bluetooth car audio profile. One of our active areas of work at the center has been in developing medical-grade profiles for a few of the devices we work with. So we've been fairly active in developing things like blood pressure profile and health thermometer profile and glucose profile, and there's 4 or 5 others that we've been sort of actively at that deal with the devices that we're working with. So we've gotten a fair ways into this effort of creating all of these profiles that various apps and various devices can get in. There's been a fair bit of success there. What do we do now? We play the waiting game. So we're hoping all of that work is going to pay dividends over the next while. The problem, of course, with medical-grade devices, I mean, medical scales are an interesting thing as an example. They have a fairly long product life cycle, and the standards have been finished in the last year. So we're hoping during the next refresh of all those products, we'll start to see these things turn into real products. We will see. So far, Bluetooth has helped us, but it's hurt us a fair bit. Standard number 2, EHR integration. So, I mean, this is, to me at least, the harder of the two problems to solve. And I mean, probably to lots of you, maybe the more interesting of the two, just because it's a bit more of a mystery how this stuff works. How do we get data off the phone and into people's electronic health records? How do we get data out of people's electronic health records and into the phone? Of course, we do that with standards. There's a bunch of examples of things that we might want to do in that world. And I mean, this is a little list of things I came up with, potential use cases. But I mean, if you've got an idea for a medical app, chances are there's dozens more crazy ideas of bits of data you think would be amazing to get in and out of the health record that I've probably not captured here. To sort of understand why it's traditionally been difficult to do that, you need to think a little bit about how health records have worked in the last literally 30 years in hospitals. Hospitals today, and this is the case more or less around the world, are built on this old protocol called HL7 version 2. They work with this sort of, this method where effectively data gets copied from every system that produces the data to every other system in the hospital that might possibly want to see a copy of it. So if I'm in a system that's ordering lab tests, for instance, every system that might possibly want to see that copy of that lab order is going to get a copy of that. And we're replicating data all the way across the hospital, more or less constantly, using this ancient protocol. Thinking about that in the context of phones, I mean, that's really not something that scales well to phones. I couldn't imagine a world where I'm copying every single lab test into a phone in real time. That sounds like a nightmare to me, but this is kind of the way that systems are built today in the world of EHRs. The protocol they use, if anyone is curious, this is an HL7 version 2 message. On top of the method they use being weird, the messages themselves are just a nightmare to work with. They're separated by lots of pipes and little carets and blocks of text where you're counting fields. Hopefully there's at least someone in this room that looks at that and thinks it's beautiful. It's actually kind of beautiful to me, just because I've been doing it for a long time, but they're ugly, I know. Back in 2011, a few of us got together in the sort of health standards world and started thinking, how could we do this better? How could we come up with a protocol that would enable app developers to get access to EHR data in some sort of sensible way? And we spent a bunch of time looking at really trying to look outside of the world of healthcare, just because healthcare has lots of old-fashioned technology, has been very slow to embrace new technology. So, I mean, in all honesty, we spent a whole bunch of time going over the fine details of how Twitter's API works and Facebook's API works, and 37 Signals was a big one for us, just because they're fairly well regarded. I mean, they're called Basecamp now, but they're fairly well regarded as having a very well thought out API. So we spent a bunch of time looking at other industries and how they had solved public internet-facing APIs, and then tried to apply the same principles they had to health data. What we came up with was a thing called FHIR. Fast Healthcare Interoperability Resources. Oh, I screw that up every time I say it. The idea there is FHIR is a RESTful API that basically exposes health data coming out of EHRs as a RESTful API, much the same as other internet-facing APIs work, with the aim of enabling app developers to get into health data, to access it, to consume it, to produce it, basically to work with EHRs, much as they work with Twitter and much as they work with Facebook, so on and so forth. The messages that we came up with look like this. I mean, it's really, my point today is certainly not to explain the inner gory details of FHIR to you, but this is an example of what it looks like. And hopefully anyone looking at this, if you don't understand the minute details, that's fine, but hopefully you can sort of roughly make sense of what we're doing here. We've got a JSON structure that's fairly flat, that has, it's got references to patients, and it's got some numbers that are lab results and stuff like that. Ultimately my point here is, and of course it's a RESTful API, so we've got a URL that will take me right down to the thing with a well-defined URL structure, as RESTful APIs tend to have. FHIR works by modeling all of the bits of data we care about in terms of these things that, of course, we call resources. Resource, the term, comes directly out of the HTTP specification and is the R in FHIR. Effectively, FHIR is a set of data models for everything that you would deal with in healthcare. So we've got data models for things like patients, for things like emergency department visits, for things like immunizations, for things like lab tests. Every one of those things has a resource data model, and these data models are sort of usable more or less across the board if you're building an app that needs them. We've taken great pains to sort of build this data model in a way that it's developer friendly. Previous iterations of anything that ever happened in health were generally geared towards doctors consuming them and people who are sort of with advanced degrees in medicine. We've taken lots and lots of effort to make it so that, to make the standard sort of written in such a way that people who don't have a medical background, people who are software developers, can look at the specification and get up and running, can sort of make sense of it and get working with medical data without necessarily having that deep background on how medical data is structured and how, the vocabulary that's used by doctors day to day to describe that data. Probably most importantly to me, and this is one of these things that's maybe less interesting to you guys if you're used to dealing with, I don't know, the Twitter APIs of the world, but traditionally health standards don't work this way. Everything in FHIR is CC0 licensed, so it's a completely royalty-free standard. Anyone is welcome to take it. You can host your own copy of it. You can build it into your products. You can use the data model even if you're not using the rest of the standard. Much like a lot of these things, really the only thing you're not allowed to do is create something different and call it FHIR. The trademark of the name is really the only restriction they have on any of this stuff. So it is really, really an open standard, which, I mean, if that doesn't impress you, great. If you've been working in health at all, hopefully it does impress you. It's pretty neat stuff. There's lots and lots of tools out there for getting started with this stuff. I'm pointing to one just because it's one that we developed over at the center, but there's a bunch of others. One of the really neat things that sort of exists in this world is there's a bunch of public servers that basically act as EHRs today. So if you wanted to start building a medical app today, there's a bunch of servers you could connect to that sort of play that role of being the EHR. And they're seeded with a bunch of test data. They've got things like lab tests in them. And they're exposing that exact RESTful API that the EHR would be exposing. So that you could today go in there and start building an app that pulls that data out and massages it, maybe saves it back, whatever it is you want to do. This is one example of it here, firetest.uhn.ca. It's a completely free and open site. There's no registration or anything like that. You can just go to it. The source code to it is even up on there. So if you want to host your own copy internally, that is absolutely a thing as well. And lots of people do exactly that. So the tooling is quite open. Again, I point to our own site, but there's lots of other examples as well that are out there that you can play with. So there's plenty of these, plenty of sort of open tools and open API sites where you can start playing with FHIR. Pardon the pun, to build your apps on top. I will mention as well, given that we're at an Android event, One of the other things we work on at the center is we have developed an Android library. So we've got a Java implementation of Fire, we've got a client implementation and a server implementation. To anyone doing Android dev, really the client implementation is the interesting thing. We have built up a library that you can bring in, and it's a jar, and it's on the Maven and the Gradle repos and all of that stuff. So by all means, check that out. There's lots of people building medical apps against these standards today. This stuff as well is all free. It's all Apache licensed, so it's available. It's certainly available for you to play with. happyfire.io is the address for that, and certainly if you went on GitHub and plugged in Happy, you would find it as well. So we've talked a little bit about access to data. The other part of the puzzle, if you're trying to build medical apps, of course, is API security. Naturally, I mean, it's all fun, playing with public servers. The second you want to take any of this stuff into a real situation, you instantly start diving into the nightmare that is getting this stuff in any kind of secure way. And of course, health data is very sensitive stuff. We have to protect it. Luckily, people have spent a bunch of time thinking about that. I love this slide for non-healthcare people, just because I like to be a little bit hyperbolic about it. I think this screen here, the Facebook OAuth grant request screen, I think this is the thing that's going to change healthcare over the next couple of years, which is, of course, a kind of hyperbolic thing to say, but let me tell you why. Of course, this is all powered by the OAuth 2 protocol, which to anyone, I mean, I'm sure you all know what OAuth 2 is, but to anyone who doesn't, this is the thing where if I'm playing Candy Crush, because I'm one of those annoying people, I will, sign in through Facebook with Candy Crush. It will take in my credentials there. It will ask for a bunch of these OAuth 2 scopes, which are basically the scopes in OAuth, or the thing that authorizes Candy Crush to post on my timeline. And ultimately, I will use that to send a bunch of my friends messages saying, hey, why don't you play Candy Crush too? And they are all delightful and jumping, because they love that. We all love that. The group that I was talking about before, Boston Children's, spent a bunch of time thinking about how could we apply that methodology to healthcare. And the thing they came up with is what they're calling Smart on Fire. So layered on top of Fire, the data standard, they've layered a security standard using the OAuth 2 protocol for the authorization of health apps into EHRs, basically into the health record. They've defined a bunch of these OAuth 2 scopes for things like, I'm writing an app that needs access to lab results, or I'm writing an app that needs to be able to author new immunization records, that type of thing. So they've defined a bunch of scopes that your app could connect to an EHR with, and then say, I'm asking for these positions, or for these permissions, then ultimately sort of authorize themselves into that. The information on all of how that works, you'll find that at Smart Health IT. It's really a cool technology and sort of starting to come to its own in the next little while. In terms of who is doing this, just because this is the next question people ask, is, great, you've shown me a bunch of technology, you've shown me some data APIs and some security APIs, what can I do with that? I was giving a talk like this about a year ago, and a year ago my answer to that question was a bunch of people are working on it. I can't really point to anywhere you could do this stuff in production, but keep following it, because it'll be in production soon, I'm sure, and you'll be able to play with it. That situation has changed really for the better in the last year. So, I mean, if you don't recognize these names, and quite possibly you don't, these are 4 of the names of the biggest EHR vendors in North America and really across a large part of the world. If you've visited a hospital in the last any amount of time, there's a decent chance they're using one of these. Every one of these vendors either have finished their Fire APIs and have customers using them, or at least are working on them and again, have them coming in the next year. They've started running health hackathons where people are developing apps, and their hospitals, the customers that are paying them for their software, are integrating apps in that were written sometimes by third parties, sometimes by the hospitals, sometimes by innovators and startups, any of that stuff. This app ecosystem in health is starting to come to its own. So where we were at 10 years ago with app stores for every other type of data, I would say we're finally getting to there in health. So exciting times to be a health app developer, shall I say. Smart created this wonderful website. I mean, the term App Store for Health, if you work in health, it's again a bit hyperbolic, but I mean, I kind of like it because people gravitate to it a little bit and understand what we're talking about. They've created this wonderful app gallery of apps that have been created using Smart on Fire. Sadly, most of what they've got on there today are web apps. The next generation of all of this, of course, are going to be the Android and the iPhone apps that start to connect into that stuff. So we're starting to see traction there. I think that's going to be the next wave, and I'm hoping a few of you will get excited and start working on that. Certainly we are at the center. We're very excited about all of this stuff starting to come to its own. So what does the future hold? I've got a couple of slides on where I see things going. and where I don't see things going. Let's talk about that for a second. A couple of interesting ideas people are working on. This one I absolutely love. The idea of health records traditionally has always been something that my doctor manages for me. The thing that I love about this sort of model of using OAuth granting screens and sort of apps on top of that is it has the power to change the entire way we do health records, basically to turn it upside down so that I, the patient, manage my health record. The model really should be that I grant a specific doctor access to write to my health record. I grant another doctor access to look at it for a certain amount of time, and maybe I revoke that access. I should be the one managing it. And I mean, the technology that's starting to come to its own in that world is sort of enabling that vision. I think it's a really cool thing. The bit I love is, I mean, to me, it sort of turns my health record into my Facebook feed. Like, it should be something I curate, much like I curate my Facebook feed. The second thing I think is really cool coming through with all these health apps is this notion of research at scale. So I was talking about research at the start, and the whole concept is really neat. If you imagine sort of, 1,000 people using an app, and then you scale that up to 10,000, you scale that up to 20,000 and beyond, all of a sudden you've got this notion of this sort of powerful computer constantly collecting data from lots and lots of people. Enables this thing that we're calling research at scale. So the idea here is instead of running research trials in healthcare using randomized control trials, the old sort of way we've done that, if we just take massive amounts of data from tons of people who have consented to us researching on their data, really we can come up with new outcomes that weren't even possible using the old clinical trial model. It sounds, I mean, if you've ever, if you're a researcher, this maybe resonates with you or maybe sounds crazy. The cool thing is it's happening today. There's a project called Sync for Science down in the States right now that's actually working with those same protocols I was talking about, Smart on Fire and the OAuth protocol and the Fire data standard. For this initiative, they're calling Sync for Science. And Sync for Science, they're aiming within the next couple of years to have 1 million people contributing all of the data that is relevant to the researchers using the data with the aim of curing a bunch of diseases. So very cool stuff. Up here in Canada, we're working on a thing called Diabetes Action Canada, which is sort of trying to take a limited data set. We're just worrying about diabetes, but we're aiming to solve those same problems within our sphere. One other idea that I think is kind of interesting is this notion of the artificial pancreas. The artificial pancreas is this idea that people who are suffering from diabetes often have a bunch of devices. They'll have an insulin pump, they'll have a glucose monitor, and often they'll have a cell phone. The idea with the artificial pancreas is if we sort of marry all of those concepts together, the cell phone ultimately could control the delivery of drugs based on feedback that's coming from glucose monitors on your body. So you've got this amazing closed loop of technology that's sort of centered around your cell phone controlling a bunch of devices. Ultimately, it's not a cure for diabetes, but it certainly comes close. One failure, I absolutely love this story. This came out a couple of weeks ago, actually. This is the best example of failing. This is the largest health insurer. I'm not going to name names, but it's pretty easy to figure out who it is if you spend any time sort of looking into it. Released a health app that allowed patients access to their chart, and this is serious. If you bring up the Play Store and look at their app, there are literally nothing better than a 2-star review of the app. There are thousands and thousands of reviews. They haven't really hit it out of the park with this. So health apps are hard to get right. I think that's the point there. I've got a couple of last thoughts here. So where do we go from here? I've got a couple of links. Here's where you learn about FHIR, hl7.org/FHIR. If you want to play with FHIR in your app, hit us up at happyfhir.io. That's a great way to get into that. Join the project. If anyone here wants to get involved in an open source project and doesn't know where to start, we would absolutely love to have you at the Happy Project, especially Android developers. We've got lots of people doing server development and stuff like that. We have struggled a little bit to find people doing Android development who want to get involved, so we would love to have you as contributors for that project. Finally, I have to give a shout out to the eHealth Ontario Innovation Lab. eHealth Ontario have spent a bunch of time and continue to work on this, coming up with an innovation platform for Ontarians to connect to basically the infrastructure that exists in Ontario for health record storage. One of the things we're working on now is Smart on Fire enabling all of that infrastructure. So there's a bunch of really good developer resources for Ontario health app developers at innovation-lab.ca. That actually takes me to the end. So I would love to hear from any of you. That's where you will find me. Thank you.